Thanks for staying with us on The Real Story. I want to bring in two medical professionals right now who are also in the legislature. Joining us this morning, Dr. William Petit. He is a retired endocrinologist and also a member of the House. And we also have Dr. Saud Anwar, a pulmonologist who specializes in the respiratory system, who's also a member of the state Senate. Good morning to both of you. Appreciate you both being involved in this discussion.
Good morning.
Thank you so much for having me.
Now, you both are also on the Public Health Committee in the state. I do want to note that. All right, but first, let's just talk about what we know about this disease right now. Is it airborne?
Yes, it is. It is airborne as well as droplet and also contact. So it can spread through aerosolization pretty much, and that's our fear about this.
I know people say wash surfaces, that you should continue to sanitize. Are you worried about droplets falling onto a surface and then you picking them up and putting them on your face? Is that why we're continuing to say wash hands, et cetera?
That's exactly right. The droplets are heavy and typically fall, and a lot of them end up on the floor. But if you're near a surface, the table or counter, they may end up there. So better safe than sorry.
Big concern with high-risk patients with this disease. You both have different specialties here. I want to start with you, Dr. Petit. You are a retired endocrinologist. What would your advice be to patients right now? I know you had dealt with folks who had diabetes, and that would be a high-risk factor, right?
Definitely. Unfortunately for us, age is a risk factor. A lot of the lethality in the disease, a lot of the deaths are so in addition, obesity appears to be a big risk factor, and many people with type 2 diabetes suffer from that. Obviously, other underlying conditions where people may be immunocompromised, maybe medications they take put them at higher risk. So you really need to redouble your efforts if you're over the age of 60, have a chronic illness, especially heart failure, chronic pulmonary conditions, and I'll let Dr. Anwar add to that.
Yeah, Dr. Anwar, certainly your patients heavily impacted by this disease because it is a respiratory pathogen.
Yes. So again, the high-risk population remains the ones who are a little older, over the age of 60, 65, hypertension, diabetes, a big risk factor. Having chronic lung disease, whether it's fibrosis, whether it's COPD, and some severe asthma patients, we worry about them. And heart disease, anyone who has limitations in their functionality from some of these conditions would be high risk because they may not be able to sustain the significant impact it has on the entire body. So that's our fear.
You have patients going into the hospital. They might get a lung infection, for example, pneumonia. What do you think the survival rate is? Once someone gets pneumonia, is it difficult to clear that up when they have COVID, Dr. Anwar?
So I can tell you between February, March, and now, we are in far better place than we were before. We have learned a lot about the disease. We have learned about how to manage it. So again, with severe disease, when it impacts the lungs, when you have what we call the ARDS, where the oxygen levels are very, very low and people with the lung become unable to exchange oxygen, those patients remain very critical, but our survival rates have improved because of using treatments in a timely fashion and much more aggressively. So it remains a very concerning and a dangerous and a lethal disease, except that we are better than where we were before.
I know both of you are going to say wear your mask because that helps prevent the spread. I want to start with Dr. Petit on this. When you see people making masks a political statement, what's your reaction to that? Is it difficult with your medical professional background to hear people bringing that into the political arena?
Well, I just think it's hard to have perfect science on these things, and this is a pandemic where we've been learning as we go along. From the big picture point of view, when you look at the countries where there's been significant mask wearing, Taiwan, Hong Kong, Australia, New Zealand, Canada, they have rates that are far lower than what we have in the United States. And people tend to cherry pick certain studies and say that it proves this or proves that. But I think the biggest fact is that the countries that have adhered to distancing, masks, and good hygiene have had.
Dr. Anwar? I know you
Yeah,
wanted to
so
say something about that.
the virus is apolitical. The virus does not know who is of what political party. It does not know who we voted for. The virus actually leads to equal infection risk on people. So wearing a mask is critical. It is not a political statement. It is actually just a public health requirement and a smart thing to do to protect the people that we care about, our neighbors, our family members, our children, adults, everyone.
You both, again, are on the Public Health Committee. We didn't have a session, essentially, because of COVID this past year. We have the new legislative session coming up. Congratulations to both of you on winning back your seats. Curious on what you think, what government action you think is going to be taken in the Public Health Committee, if any. I mean, we know Governor Lamont has had these expanded authority with the executive actions he's had to take. What do you foresee the Public Health Committee doing?
We're going to have to continue the work that's going on. As you're right, we're under the emergency preparedness rule until February 9th, at about which time committee hearings will get going, and I'm sure there'll be COVID-related issues we have to deal with. There's a long-term care committee dealing with skilled nursing facilities and assisted living facilities, where we're hoping for changes that will chronically improve the safety of people who are the most vulnerable from COVID and perhaps other viruses or other infections. And finally, a big issue is going to be economic, given the problems that the pandemic has caused for us economically. We're going to have to take a very close look. 21-22 will be the biennial budget, and we'll have to see how the revenues are and where we stand. How it's been impacted by COVID.
Dr. Anwar, does the fact that we have Joe Biden, former vice president, now president-elect, coming into office, does that change the way Connecticut looks at dealing with the virus?
Well, I can tell you Connecticut has been ahead of the curve in recognizing what our responsibility was. We were behind in our support that we received from the federal government. And I believe that with the federal government now being much more ready, focused, and with the understanding of the disease itself and making it a priority, because President-elect Biden has been very clear that this was going to be one of his top priorities. I'm hoping that all the states will get a lot more support, financial, but also technological. And by that time, the vaccine will be available. So I'm expecting a lot of hopefully good things from the timing point of view, but collaboration point of view as well.
We talked with about the vaccine with Dr. Gifford. I'm curious to hear both of your thoughts on what's being developed right now. Again, Pfizer coming out with the news this past week. How do you convince people to take this vaccine once it becomes available, or a vaccine, whatever happens through clinical trials? Dr. Petit?
Well, we have the Vaccine Advisory Committee overall, which has 3 subcommittees: a science subcommittee, a communication distribution, if you will, committee. I'm on the science committee, and we're going to revet the data that the FDA and federal authorities use to approve, even under emergency use authorization, the vaccine, see if it's something we want to go ahead with. That may go forward as soon as 2 or 3 or 4 weeks from now. But I suspect people are going to have more time to think about it, because I don't think we're going to have widespread distribution of the vaccine until the late winter, early spring of 2021. I think there's about 4 vaccines, 2 RNA vaccines and 2 viral unit vaccines that are in phase 3 and getting close to be able to submit their data. So I think we won't be seeing widespread vaccination probably until 3 to 6 months into 2021. As Dr. Gifford told you on your earlier segment, that's going to go first to the people on the front lines: nurses, physicians, people at nursing homes, the nursing home residents themselves, first responders, people at high risk, and then we'll work into the elderly community as well, and so on. But those specific decisions are going to be made by the advisory committees with recommendations to the governor.
Dr. Anwar, is this? Go ahead. Yep.
I can just add a little bit. So the phase 1, phase 2 studies have already been published. In August, Nature magazine, we have already looked at the vaccine that Pfizer is looking at and working on. and the dosages were much higher than the actual dosages that will come out. So we know about some of the side effects, and with the current dosages, I can expect, at least from the previous published data, that it is going to be reasonably well tolerated. But with some 43,000 patients, it's going to be pretty robust science behind it. Now, this is not politics. We shouldn't be looking at it. It's pure scientific evidence that we have to look at, and this is a diverse population that has been studied. So we will have a lot more information as soon as it's published, and I'm very hopeful that once we look at the data, we will all feel more comfortable.
Agreed. Dr. Saud Anwar, Dr. William Petit, appreciate your time this morning and your insight.
Thank you.
Yeah.
All right, that does it for us on The Real Story. If you want to watch these segments again, head to fox61.com or download the Fox 61 News app and watch The Real Story every Sunday at 10 a.m. right here on Fox 61. Have a great morning.